Welcome to this comprehensive exploration of alcoholism and alcohol abuse. In this video, we'll shed light on the definition, symptoms, and effects of this pervasive issue, as well as different avenues for recovery. Let's start with a brief overview of alcoholism and alcohol abuse. Alcoholism and alcohol abuse are terms often used interchangeably. However, they have different meanings. Alcoholism is a chronic disease marked by an inability to control alcohol consumption, despite adverse consequences, while alcohol abuse refers to excessive drinking that can lead to problems but doesn't necessarily involve dependence. Let's take a closer look at the difference between these two terms. Alcohol abuse involves patterns of drinking that lead to harm or distress, while alcoholism is a more severe form characterized by physical and psychological dependence. Recognizing the signs of alcohol addiction is pivotal. The most notable sign would be losing control over drinking habits, which would cause a hindrance in everyday life and relationships. This can bring about stress and anxiety, further fueling the desire for alcohol consumption and turning it into a vicious cycle. Now that we've touched on the difference between alcohol abuse and alcohol addiction, let's talk a little bit about how alcohol affects the body. Understanding how alcohol affects the body is key. Its effects on the body are severe, but they are often underestimated. Alcohol can cause significant harm to your liver and your brain, leading to extreme medical conditions. Conditions can sometimes include liver disease, heart disease, and neurological damage. It can be even more threatening when it is mixed with other drugs. Contrary to common belief, alcohol is a depressant. It inhibits the nervous system and impairs brain function. It is a drug, and it will slow you down, even if it doesn't feel like it does. Long-term excessive use can cause significant damage to your body and lead to dependence, at which point professional intervention will be required. Deciding when to seek out rehab for alcohol is a personal journey. Some signs could indicate to you or your loved one that it's time to seek professional help. Signs include problems in relationships, work, health, legal trouble, or financial issues. Recognizing these signs and getting in front of them before they get worse can make all the difference. There are tools available to you or your loved one that will help you accomplish this. The first step in recovery often involves medical detoxification. Medical professionals usually supervise this process. It ensures a safe withdrawal from alcohol and helps you or your loved one manage withdrawal symptoms and minimize risks. Alcohol withdrawal duration varies, peaking within the first 24 to 48 hours and subsiding within a week for most individuals. However, depending on the case, they can be more prolonged and intense. Withdrawal symptoms can range from tremors, insomnia, anxiety, and elevated blood pressure. Professional help is required to manage potential complications during this process. Let's move on to a topic that's on all of our minds but isn't discussed nearly enough: the challenges of avoiding alcohol in social situations. Staying sober at social events is hard. It requires proper planning and communication. There is no way of completely avoiding the pressure to drink. It can come from friends, family, and even societal norms. Feelings of loneliness can creep in, making it challenging to stick to the commitment to sobriety. By surrounding yourself with understanding individuals, you will quickly discover that you're not alone in your struggle. Practicing mindfulness, having a support system, and being honest with yourself and others go a long way. Remember, it's okay to seek help, even if you are someone who is living with an alcoholic. It often leads to feelings of loneliness and isolation. You may feel like you're the only one going through this. Not many people understand living situations like these bring their own set of challenges. That's why it may seem hard to reach out for support. You'll need to practice open communication, setting realistic expectations, firm boundaries, and avoiding enabling behaviors. It's not easy doing all of this alone. Approaching a loved one about rehab is a delicate process. You must take the time to do this right. We encourage you to educate yourself and to create a game plan. Express concern without blame and let your loved one know they are on your mind. You don't have to be the one affected to receive support. If you are a friend or a family member, help is also available for you. If you're already looking into rehab centers but aren't sure what to look for, here are some helpful tips to remember when choosing a rehab center. Look for evidence-based treatment, medical support, holistic approaches, individualized treatment plans, continuing care, and experienced staff. Rehab options vary, but the first step is always the same. It's seeking professional help. The type of rehab will depend on you or your loved one's individual needs and circumstances. And then there is aftercare. Aftercare is a major component of recovery. At Simcoe Addiction and Mental Health, we provide lifelong support to all of our graduates, offering tailored resources, continued guidance, and free aftercare programs. If you're in Toronto, Simcoe Addiction and Mental Health offers a practical alcohol addiction treatment program. Our inpatient center, located just outside of the city, caters to diverse needs. Whether seeking help for yourself or supporting a loved one, remember that recovery is a journey, and there is hope. If you are looking for additional support, you can visit our info and support page under the Resources tab on our website. Together, we can navigate the path to lasting recovery. Until next time, take care.